My name's Lillian Richards and I'm going to be talking about spot reduction. We'll start off by defining what exercise is. Exercise is a physical activity that is planned, structured, and repetitive for the purpose of conditioning any part of the body used to improve health and maintain fitness. While many of us are aware that there are different levels, techniques, and types of exercise, we also know that there's different types of exercise that work different muscle groups in our body. Many people believe the idea that if they work certain areas of their body, they can reduce fat in just one area. This technique or idea is called spot reduction. One website defines spot reduction as localized fat loss through specific exercise. While many people are told that if they work just one area of their body, like their abdominal muscles, they will be able to lose fat in just that area. There's many different diets and workouts that agree with this statement. People technically use this technique in order to reduce stubborn stomach fat or reduce certain thigh size. But the main question is, how effective is this method? There was a study done over a period of 12 weeks where the subject would use a leg press to work their non-dominant leg. They had their body mass, bone density, lean mass, and fat percentage taken before and after the training period. They also measured the adipose or fat tissue deposits in the trained leg and the sedentary muscles. They did high volume endurance training exercises in order to see the best results and outcomes. They were also instructed to perform their regular lifestyles and their normal physical routines and eating habits. They thought if the notion of spot reduction is correct, then performing a regimen of unilateral leg extension exercises should affect adipose content in that leg region to a greater extent than in the other leg or any other body area. At the end of the 12 weeks, they found an interesting finding of the present study was that after localized training intervention, the lower extremities do not experience a significant reduction in fat mass. They took a measurement of total body and they discovered a significant decrease in total body fat. When the trunk and the arms of the body were measured, they noticed a significant decrease in fat mass, but no decrease in bone mass, lean mass, or fat percent. When they measured the trained leg and the controlled leg and compared them to the arms and the arms and the trunk showed an increasingly higher number of fat reduction than the trained leg, but not in the controlled leg. The reason why the fat mass was significantly reduced in the upper body and not in the lower body may be related to the initial fat content of different body parts. At the end of the study, they concluded the training program applied effectively reduced fat mass, but this reduction was not achieved in the trained body segment. So does this technique actually work? One website said that they do not discriminate when it comes to energy storage. It pulls from everywhere and sends it to where it's needed. So when an individual is trying to lose weight in one area, the body will pull from or needs energy, the body will pull from where it has the most to lose and send it to where that area needs it most. Many different studies have been done on this topic. It is a very controversial topic of whether spot reduction is an accurate way to lose fat mass. Most studies, however, say this is not an effective method. However, you cannot pick and choose where you lose fat from, but you can tone certain muscles and muscle groups. Most of the studies show that some exercise, like working the legs, will increase leg lean mass, where fat mass was higher reduced in arms and the trunk area. And there was also a study done while abdominal exercises and training were done, they did not reduce the localized fat around the trunk area. Although this technique is not completely accurate, there are still some useful thoughts behind it. This technique could be good for major weight loss. They can work certain areas of muscle groups and focus on the big muscle groups in order to lose weight around their trunk or in their arms in order to help their progress along the way. This technique might also be well adapted for someone going through rehabilitation and needs to work can only work certain areas of the body. This would also be good for toning certain muscles and overall muscle group. However, this technique is not good for targeting certain areas of